Hello, I'm glad you decided to join me again. In the last segment, we discussed the INC-MIC method. INC-MIC is an acronym for Identify, Name, Classify, Manage, and Conquer. And it is a theoretical model that I developed as a general approach that can be utilized to address different issues that we may be facing in our lives. They may be causing us distress, anxiety, maybe even depression. But as a little disclaimer here, I'd like to say that in no way should this method or any method be a one size fit all approach to addressing unique issues. We're all unique individuals, and our issues that we deal with in our life are unique to us. So we should be careful not to accept any model or any theory as a one size fit all. And also, if your issues are of an acute or more serious nature, I highly recommend you seek professional counseling. So, with that said, I'd like to begin by again reminding everybody that I am a professional counselor. I am a uh, development, personal development, and empowerment coach. And I work with clients with all kinds of issues from career to more clinical issues, and I really enjoy my work. However, I am often limited in what I can say candidly and openly. And I got into this profession originally because of, I guess you can call it a calling, a need that I had to be of service to others in helping them become the best they can be. And becoming the best you can be means you are ridding yourself or removing the limitations in your life that are caused by disabilities. And disabilities are not always physical disabilities or even mental disabilities. Sometimes there are just issues in our life that are causing us not to be able to function at the capacity that we know will be most effective. So we're needing sometimes to just move toward another or a higher level of change and development. And as I said in the last segment, change usually comes from being empowered. And the INC-MIC method is one method, one approach that could be utilized to bring empowerment to your life. And that usually produces change. So, with that, let's go. Okay, so let's start with the first letter in the acronym, and that is the I, that is also identify. Identify. Oh, yeah. I mentioned that this method was a simple one. In theory, it is simple because one thing links to the other and the other. The identify links to the naming, and the naming links to the classifying, and the classifying, the management, and the management, the conquering. So, yes, in theory, it is a simple method or a simple approach. However, it's not easy. Nothing is easy that's worth helping you. If it's something that's going to help you and develop you, it's going to take work, and the work is going to be on your part. So, identify. Most crucial piece. To identify does not mean to diagnose or give yourself a label or a diagnosis. We need to be careful not to be so quick to diagnose ourselves. We don't want to call ourselves bipolar or have a depression or give those other labels to ourselves, addicted. All of the labels can be true, and they're clinical diagnosis, and they're definitely something that's needed. However, usually those labels or those diagnoses are linked to other issues. And I want to get to the crux or the core or the foundation of what's beyond or behind or beneath the labels, the more common traditional labels. So let's remove the labels for a minute. And let's just talk about some of the things that are happening to us that we need to identify what that thing really is. The thing I usually ask clients to do to identify or to be able to find what the real issue is to journal, to write down, especially those times that you are experiencing. Let's say, for example, we're talking about depression, okay? the times that you are experiencing the most depressed moments or states. Okay, so when you're feeling that way, you want to make sure you journal everything you are feeling, every thought, all the thought processes, the feelings. Be as explicit and succinct and clear as you can in your description. Okay, that's one piece of the journaling. The other piece, in contrast to that, is I also want you to journal those times that you're not feeling it, the times that you're feeling the most strength, the times that you're feeling that thing, that addiction, that depression, whatever it is, that anxiety is not really prevalent, that you're feeling free, the most powerful. Make sure you journal those things and your thought processes. And what you will notice after maybe a couple days to a week of journaling is that you see a pattern. And when you see that pattern, you can pinpoint or identify the real issue. And the real issue, again, is not necessarily the result of what you're feeling, which you could call depression or anxiety. Those are symptoms. We want to get beyond the symptoms and get to the cause. And once you look at your journal and you see what's missing when you're not feeling it, and what's present when you're most feeling it. And then when you see what's present, you can then look at the things that are happening, and then you can dissect your thought processes. What I mean by dissect, if you look at dissembling something, okay, so you want to dissemble it where it becomes defragmented. It becomes fragmented, I should say, in little pieces where you can examine. It's just like taking a piece of equipment apart. You fragment it, you examine it, and you see what's all there. That's what you're doing with your journaling. You're looking at what you're writing down. You're looking at your feelings because you're writing them down. And then you're able to fragment or take apart everything that's happening. And when you contrast it to when you're not feeling that way or when you're feeling the most powerful, you could compare and contrast those two things and see what's missing and see what's really happening. Now, again, you can apply this to anything. I don't want to say a specific thing. I used depression earlier just so you can relate it to something, but you can apply it to anything. Now, this is going to take some work, as I said. You're going to have to do your journaling for days, maybe even weeks, until you start to see that pattern. But once you see the pattern and once you fragment everything into pieces and you find those little pieces that are, aha, this is the issue, this is what this is really about, then you can name it, because naming is connected directly to identifying. And the reason you need to identify it first is because you're going to give it a name that's associated with how it affects you. You're also going to give it a name that reflects your feeling about it and how you can manage it. It needs to be a name that calls it out. So every time you call this thing by its name, you know, that's what it is. Don't own it. Don't mystify it by calling it some complicated. Don't make it something that's unreachable by giving it a diagnosis name. No, call it what it really is and what it really is to you. So now that we've covered identifying, of course, the next step is naming. And naming is going to be directly related to identification. So let's work on journaling. Let's work on writing those feelings down when you're feeling the most defeated and the most powerful, and contrasting the two. And when I come to you again, we can talk about naming it. Until then, I want you to have a wonderful day, and I want you to remember, Inc. Mick. Remember, identify, name, classify, manage, and conquer. You can do this. This is going to be great. I'm excited. Thank you for joining me. Until next time.